You may know that vitamin D is essential for the health of bones and teeth and can also enhance the immune system. If you want to learn more about its benefits for the body, please continue watching this video. Firstly, it's important to understand that vitamin D is a fat-soluble vitamin, meaning it can dissolve in fat and be stored in the body's fat tissues and liver. Therefore, daily supplementation through food or supplements is not always necessary. The chemical name for vitamin D is calciferol, and it is a type of steroid hormone found in animal-based foods and synthesized in the human skin. There are two main forms of vitamin D, namely vitamin D2 and vitamin D3. Vitamin D2 is primarily derived from plant-based foods such as mushrooms, while vitamin D3 is found in animal-based foods like fish, eggs, liver, and is also synthesized in the skin during exposure to sunlight. Generally, vitamin D3 has a higher bioavailability than vitamin D2, making it easier for the body to absorb and utilize. Vitamin D serves various functions, primarily categorized as follows: regulating calcium and phosphorus metabolism. Vitamin D promotes the absorption of calcium and phosphorus in the intestines and regulates their excretion by the kidneys, maintaining a balance of these minerals in the blood. Calcium and phosphorus are crucial components for bone and teeth formation and contribute to the normal functioning of the nervous, muscular, and cardiovascular systems. Modulating the immune system, vitamin D influences the differentiation and activation of immune cells, strengthening both innate and adaptive immune responses. It enhances the antimicrobial capabilities of cells like macrophages and neutrophils, and it helps balance the inflammatory response, preventing excessive inflammation and autoimmune reactions. Therefore, vitamin D is beneficial in preventing and treating various infectious and autoimmune diseases, such as colds, flu, pneumonia, tuberculosis, multiple sclerosis, diabetes, rheumatoid arthritis, and more. Regulating the nervous system. Vitamin D interacts with vitamin D receptors on nerve cells, affecting their growth, differentiation, and function. It promotes the synthesis and release of neurotransmitters like dopamine, serotonin, and noradrenaline, which play roles in regulating emotions, memory, learning, and behavior. Additionally, vitamin D protects nerve cells from oxidative stress and inflammation, preventing neurodegenerative diseases like Alzheimer's. From the above overview, we can see that vitamin D offers numerous benefits to the body. It's crucial to ensure an adequate intake of vitamin D for maintaining overall health and vitality. So, where can we get vitamin D? In general, vitamin D is found in higher amounts in sunlight and certain foods, especially during the summer and afternoon sun exposure. However, modern lifestyles and environmental factors may limit our ability to synthesize vitamin D naturally. Factors such as prolonged indoor activities, sunscreen use, covering clothing, and residing in high latitudes can affect vitamin D synthesis. Therefore, dietary supplementation becomes necessary to prevent vitamin D deficiency. Rich dietary sources of vitamin D include fish, fatty fish such as salmon, mackerel, tuna, and sardines are excellent sources of vitamin D. They not only provide ample vitamin D, but also contain omega-3 fatty acids, offering additional benefits for lowering cholesterol, preventing cardiovascular diseases, and reducing inflammation. Typically, 100 grams of fish can provide about 10 micrograms of vitamin D, covering 50% of the recommended daily intake for adults. Eggs, especially the yolk, are a good source of vitamin D. Egg yolk contains higher levels of vitamin D and cholesterol, which serves as a precursor for synthesizing vitamin D. One egg yolk can provide around 2 micrograms of vitamin D, contributing to 10% of the recommended daily intake for adults. Liver, especially from animals like beef, pork, and chicken, is a significant source of vitamin D. In addition to vitamin D, liver also contains other vitamins and minerals such as vitamin A, vitamin B12, and iron, supporting blood, vision, and immune system health. However, liver is also rich in fats and cholesterol, so consumption should be in moderation. Generally, 100 grams of liver can provide about 15 micrograms of vitamin D, covering 75% of the recommended daily intake for adults. Dairy products. Dairy products, including fortified milk, yogurt, and cheese, are common sources of vitamin D. These products are enriched with added vitamin D during processing, enhancing their nutritional value and aiding in the absorption of calcium present in dairy. Typically, 1 cup, 240 milliliters of fortified milk can provide about 2.5 micrograms of vitamin D, covering 12.5% of the recommended daily intake for adults. To determine if you are getting enough vitamin D, you can refer to the nutritional reference intake table provided by health authorities. The recommended daily intake varies with age, gender, and life stage. For instance, adult males require 20 micrograms daily, adult females need 15 micrograms, and pregnant or lactating women may need 25 micrograms. Although these amounts may seem small, incorporating vitamin D-rich foods into your daily diet or spending some time in the sun can help you achieve these goals. However, certain circumstances may increase the demand for or decrease the absorption of vitamin D. Individuals, such as the elderly, vegetarians, individuals with obesity, darker skin tones, certain medical conditions, or those taking specific medications may benefit from vitamin D supplements to avoid deficiency. So, what are the symptoms of vitamin D deficiency? This depends on the degree and duration of the deficiency, as vitamin D is fat-soluble and can be stored in the body for a period. Prolonged deficiency may lead to adverse effects on the body, such as softening and deformities of bones and teeth, muscle weakness, joint pain, decreased immunity, and low mood. The most common vitamin D deficiency-related conditions include rickets in children, osteomalacia in adults, and osteoporosis in the elderly. In conclusion, it is essential to be aware of the importance of vitamin D for overall health and well-being by maintaining an adequate intake of vitamin D through sunlight exposure and a balanced diet. We can support our body's various functions and prevent the risk of deficiency-related conditions. Thank you for watching, and if you found this video helpful, please give it a like and stay tuned for more. Wishing you good health and goodbye.